Hello everyone. Liposuction. Isn't that a procedure done only by women? Do men also get it done? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery. And today we will be talking about Awake Liposuction specifically for men. Now, you might have heard what liposuction is, you might know what liposuction is. Basically, it's a procedure of sucking out fat. That's why it's called liposuction. It is done by making a few small holes through which the fat is sucked out. Now, you might think this is a procedure that is done only in women, and that is true. It is a very popular cosmetic surgery done in women. But you might be surprised to know that a lot of men also get liposuction done. Even men who are otherwise fit and who otherwise go to the gym, even they get liposuction done. So, why is this? To understand this phenomenon, you need to first understand that liposuction is a body shaping surgery. It is not a weight loss surgery as is commonly misconstrued. The aim of liposuction isn't to lose 10-20 kilos. The aim is to shape your body into the shape that you want. And that's why even people who are otherwise fit might get liposuction done. Now we need to understand the concept of stubborn fat. Basically, any fat anywhere in the body has receptors to two kinds of hormones. It can have receptors to fat burning hormones, or it can have receptors to fat storing hormones. The level of these two kinds of receptors varies with different fats in the body. And it's the levels of these receptors which determine how easily fat can be stored or fat can be burnt. This is why you will see that in some areas when you work out, that is the first fat to go. That fat which has higher levels of receptors for fat burning hormones goes away more easily, and that's where you see results early on when you start to exercise. Whereas stubborn fat is that fat which has more receptors for fat storing hormones. So this fat is very, very difficult to get rid of. It is the last fat to go away when you exercise. And hence, even in men who go to the gym, who do a lot of cardio, who are otherwise fit, they can still have some deposits of fat which just does not go away. And then they get liposuction done. This fat can go away, but it would require the kind of diet and exercise that most people in the regular jobs are unable to do. It is done by, like you might have seen Amir Khan in Ghajini. So when someone whose job it is to get rid of that fat and look good, they can invest the kind of time, effort and money that is needed to get rid of all of that stubborn fat. So does that mean that there is no hope to remove the stubborn fat for ordinary people? Not true. This is where liposuction comes in. The aim of liposuction is to remove that fat which you're not able to burn off by yourself. So what are some of the common areas where men look to get liposuction done? Probably one of the most common areas is the love handles or the sides. Usually a lot of men have some fat deposit over here, and this is also true for us Indians because we have a very carbohydrate rich diet. So we tend to have a lot of fat deposit around our trunk, around our tummy. So the sides, the love handles and also the front of the belly are probably the most common areas for liposuction in men. This is not including gynecomastia. Gynecomastia is a separate issue which is a hormonal condition. It doesn't have much to do with stubborn fat. So that's an entirely different condition. Leaving that out, the tummy is probably the most common area in men. Also, some men have fat deposits in their chest which is different from gynecomastia. They get liposuction done here as well. A lot of men get double chin liposuction done as well. So this is where it's a little bit different from women. In women, they have more fat in the front of the abdomen rather than the sides. They get a lot of fat in their thighs and in their arms. So these are some of the common areas in women. Now, what is the procedure like? What is awake liposuction? Generally, liposuction is done under general anesthesia, where you're completely unconscious. Our specialty is that we do liposuction under local anesthesia, which means you are awake, and that's why it's called awake liposuction. We do it this way for a couple of reasons. One, it makes your procedure very, very safe. There's no risk of general anesthesia and there's no risk of any internal organ damage. Secondly, your recovery from the surgery is very fast. You can be back to work within 3 days. And thirdly, because you're awake, during the surgery we can make you stand up, see how it is looking, make you lie down, do some more, and hence the result gets even better. Now, the procedure itself, you can't get it done, go home the same day, there's no admission or anything. When you go home, there's a bandage around the area that you have done liposuction. That bandage becomes wet because some fluid comes out. So if you do the surgery today, You need to come once tomorrow to get your bandage changed. You need to come once day after to get your bandage changed. After that, there's no need to come back. You can go back to work. Now, two things you need to understand. Firstly, during the surgery, we're only removing fat. We're not removing any extra skin. Because if you remove skin, you'll end up giving a scar. So this means that there's going to be a little bit of extra skin that has to shrink. It has to contract. Like imagine a pregnant woman after she gives birth. All that skin goes in. So it's something like that. For this skin to shrink, you need to use something called a compression garment, which is like a tight bunion that you wear inside your clothes, which needs to be worn for around 6 weeks. Secondly, immediately after the procedure, you will see part of the result. You won't see the entire result immediately. This is because a lot of the fat we would have removed during the surgery, but some fat would have been damaged but wouldn't have come out. This damaged fat gets broken down and excreted by your body, and this procedure can take around 3 months. So the full result of the surgery takes around 3 months. Now the good news is during this 3 months, since your body is anyways breaking down this fat, if you put in a little bit of effort and you hit the gym, you will see good fat loss in other parts of your body as well, because your body is in a fat burning phase. So you need to make the most out of these 3 months. Now let us look at some examples of awake liposuction in men. So those are some examples of awake liposuction in men. Let us now also hear from a patient who had his liposuction done just 2 days ago. This gentleman was mainly concerned with his love handles, but he also wanted a little bit of improvement for the front of his tummy. And here you see him 2 days ago. So you can make out that there's quite a good result already, but it's still early days. There's still a lot of swelling, and that's why it looks a little uneven at 2 days. This is what I meant when I said that the full result takes around 3 months. It takes 3 months for the swelling to come down, for some of the fat to get absorbed, and for everything to smoothen out. This is our patient 1 day after his liposuction. He had undergone surgery before and had some bulges, especially in his love handle area. So we treated that with awake liposuction. How are you feeling?
Yeah, I'm feeling good, doctor.
And how was the procedure? Was it very uncomfortable?
The procedure was very well explained right from the start, and starting from the nurses, starting from the receptionists to the doctors, all of them explained to me very clearly what is to be done. So I was very relaxed, and the entire procedure started on a relaxed note, and it went on smoothly. I didn't even feel that I've come for a lipo. It looked more like I was just like a walk in the park for me. So I'm very happy with the results.
Thank you so much. So why did you decide to undergo lipo? How does this compare with your previous surgery?
I wanted to undergo lipo because I'm already exercising every day in the gym, and I'm almost like mid-age. So I just wanted to feel good about myself, and I just wanted to carry a positive image for my body, and this will further help me. Since I'm exercising, this should add, give an impetus to my overall strength conditioning. That's my objective to look. I also want to. I don't want to be. Once I get old, I don't want to be subjected to any old age deformities or issues, related to bones and osteo, those kind of issues. So I just want to keep exercising, and this will give a fillip to my overall. To the overall impetus.
Yeah. That's a very positive attitude to have. And would you recommend us to others?
Yeah, definitely.
Thank you so much. So that was our video on awake liposuction in men. I hope you found it informative and it solved a lot of your doubts. If you have any questions, do leave them in the comments or get in touch with us. Our information is in the description and will also be coming up on the screen shortly. Don't forget to subscribe and hit the bell icon for notifications. If you have any other requests for other videos that you would like to see, do leave them in the comments. Thank you, and as always, have a great day.